In this explainer, we're going to distill the findings from a really important 5-year comparative study published in the Journal of Clinical Medicine. We'll be looking at 2 advanced implant solutions designed for the very specific challenge of severe maxillary atrophy. And what's particularly significant here is that this study analyzes what is currently the largest cohort of subperiosteal implant cases in the entire worldwide medical literature. So here's our roadmap. We're going to start by defining the clinical problem itself. Then we'll get into the 2 implant solutions under review. After that, we'll compare their 5-year outcomes head-to-head, talk about what goes into patient-specific treatment planning, and finally, we'll wrap up with the future outlook for these technologies. All right, first things first. To really understand why these advanced implants are even necessary, we have to define the significant surgical challenge they were created to solve, and that is severe maxillary atrophy. So what exactly is severe maxillary atrophy? Well, we're talking about a state of extensive bone resorption, particularly in the classifications of V and V. This presents a really complex situation for maxillofacial rehabilitation, mainly because there just isn't enough bone volume left to place conventional endocoeous implants. And these CAD models here do a great job of illustrating the kind of complex anatomical landscape that surgeons are dealing with. You can see the advanced degree of bone deficiency, and it's this very deficiency that demands solutions that can completely Okay, so now that we have a grasp of the problem, let's get into the 2 treatment modalities analyzed in the study: zygomatic and subperiosteal implants. We're going to look at how each one tackles the challenge of severe maxillary atrophy. The fundamental difference between these 2 approaches really comes down to their method of anchorage. You see, zygomatic implants use the dense zygomatic bone, that's the cheekbone, completely bypassing the atrophic maxilla. Subperiosteal implants, on the other hand, are custom-made to fit precisely onto the surface of the remaining maxillary bone itself. The surgical workflow for zygomatic implants is a fairly standardized technique. The whole process is focused on gaining surgical access to the zygomatic bone so that a pre-manufactured implant can be anchored for primary stability. Now, the subperiosteal approach, it's a completely different philosophy. It's all based on a digital workflow. It uses high-resolution CBCT imaging to design and then fabricate a patient-specific device, which ensures you get a precise anatomical fit on the exposed maxillary bone. This slide offers a fantastic visual distinction between the 2 surgical fields. If you look on the left, you can see the very targeted access that's required for a zygomatic implant. But then, in contrast, the image on the right shows the broad, full-thickness flap exposure needed to properly seat that custom-fitted subperiosteal framework. All right, let's get into the core findings of the 5-year retrospective study. This is where we'll look at the data from 150 patients to compare the clinical performance of these 2 different approaches. So this table gives us a great high-level summary of the key comparative metrics from the research. You'll notice both approaches allow for immediate loading and have very high survival rates, but they differ quite a bit in their complication profiles, how long the procedures take, and their long-term soft tissue stability. So let's break these down a little further. Over that 5-year follow-up period, zygomatic implants showed a very high survival rate of 96.3%. This really affirms their viability as a legitimate long-term solution. And for subperiosteal implants, we see a comparably high survival rate of 97.1%. What's important to note is that the difference between the 2 was determined to not be statistically significant. Okay, so while the overall survival rates are very similar, the nature and frequency of complications are where we see a significant difference. Zygomatic implants are linked with a higher rate of sinus-related issues and even potential orbital involvement. Subperiosteal implants, on the other hand, show much better soft tissue outcomes, but they do carry a risk of periimplantitis. This chart illustrates a really notable finding from the study. The data points to a significantly higher rate of postoperative inflammation when you're dealing with zygomatic implants, especially when you compare it directly to the subperiosteal implant group. And we see a similar pattern here with mobility. Zygomatic implants exhibited a higher rate of detectable mobility. The study suggests this is due to the cantilever forces being exerted on the prosthesis, which comes from that posterior anchorage of the implants in the zygomatic bone. So, given these really distinct clinical outcome profiles, let's explore the more nuanced factors that help a clinician select the right treatment for a specific patient. You see, the choice isn't based on a single metric. It's really a careful consideration of these 5 key factors, And each one has to be weighed according to the patient's unique anatomical situation and their long-term prosthetic goals. Zygomatic implants do offer a significantly shorter surgical time, but that procedural efficiency has to be carefully weighed against a statistically higher risk of some very specific anatomical complications involving the maxillary sinus and the orbit. And here's a crucial long-term consideration. What's the plan for managing a potential implant failure? You see, after a failed zygomatic implant is removed, resorption of the zygomatic bone often means you can't retreat. The subperiosteal approach, however, allows for reimplantation with a redesigned implant after a healing period, which offers much greater treatment flexibility down the road. Okay, let's wrap this up by synthesizing the study's main thesis and thinking about the future directions that this research points toward. This quote from the study's conclusion really captures the clinical reality perfectly. Zygomatic implants are great for immediate functional loading and have shorter procedure times, but they demand advanced surgical expertise. In contrast, subperiosteal implants provide a safer, more customizable option, especially when you're dealing with anatomically complex cases. So, ultimately, the research tells us that there is no single superior solution here. The best clinical choice really depends on a thorough assessment of the patient's anatomy, the surgeon's own expertise, and some very clearly defined long-term clinical goals. Individualized treatment planning is absolutely paramount. And this really leaves us with a forward-looking question. As digital design and these additive manufacturing technologies continue to evolve, how will they further improve the precision, the safety, and the predictability of what are already very complex maxillofacial rehabilitation procedures?